Again, I don't recommend smoking. I don't recommend smoking over vaporization particularly. This was done with a vaporizer that was made by a German medical equipment manufacturer, and I see their name all the time in the operating room where I work a lot because they make the monitors in that room. But I would also briefly address the downside risks. And for the patients, there are none. Basically, I've included in there a couple of review articles on cancer in the last year or so that go through all the different ways that the cannabinoids actually cause cancer cells to die and neighboring healthy cells are unaffected. The pile would be a lot higher if I brought all the articles that have accumulated since 2002 when I started paying attention to these things. And for people with neurodegenerative diseases, again, this is another area that's growing rapidly in terms of research that's available in humans. There's lots of rat research, and again, I would say the Institute of Medicine report, terrific way to find out what animal research is at, what human research is at in 1999. And there has been a lot of progress, but that's the baseline there is not to be ignored. And they were the people who recommended or told us that there were medical uses back then in 2002, and the only downside was smoking. MS patients, people with inflammatory disease, it's a terrific anti-inflammatory. It works directly on the immune system through the cannabinoid 2 receptor. And turns down inflammation without impairing the cell's response to bacteria. And so it doesn't promote infection. It doesn't, of course, cause all the body changes that steroids do when you have multiple sclerosis. And for diseases like Crohn's disease, it treats the symptoms because it reduces bowel spasms, no matter what they're caused by, and it also treats inflammation, which is the underlying cause of the disease. One of the things that everybody who's concerned about this brings up at this point is, so what is the message that we're going to send to the kids if you legalize or say it's okay for medicine? And I have put in a couple of studies which study states and neighboring states before and after it's permitted as a medicine in those states that it has been permitted. And in both of those studies, there is no increase in the use among kids. In fact, there's generally a decrease. I also tried to address your questions more specifically, and I don't know how I'm doing in time. Have I got another minute or two?
That's 7 minutes.
Oh, excellent. The first thing is its actual or relative potential for abuse. I have a little trouble understanding exactly what abuse is in your definition, and I'm sure you have a good one. I looked up things like violence and self-harm, which are two things which you might worry about. Certainly patients who are taking it are not prone to violence. It's not associated with increased violence. And it's also not associated with increased injuries. There are other aspects of abuse which I'm sure you're interested in. Again, that's, I don't do everything. The pharmacological effects are much too long to talk about at this point. They are in some of the articles that I've given you, and if you'd like, I'd certainly be delighted to send more. The current status of the scientific knowledge, again, I would suggest that the board really needs its own copy of the IOM report. I would be glad to have brought it, but the government charges money for it, even though we paid for it when it was done. And it's a book. It's got 5 chapters, deals with patients, deals with animal research, deals with social consequences, and deals with the health values, and then finally concludes that probably the pharmaceutical industry won't ever make it. In the history and current pattern of abuse of marijuana, I suggest the Schaefer report, because it was another government-funded report, which is widely underread, and dealt with the abuse part, and it didn't agree with President Nixon's view at the time, and was discarded. But it brings you up to date 1972. Abuse hasn't changed that much. A large number of people still use it and such. The risk to public health, again, I don't think it affects kids. I'm not sure what the other risks would be. The potential for it to produce psychic or physiologic dependence. I did snap out one table from the Institute of Medicine report, and that's the table that's included there. It shows tobacco is used by about 76% of the population, alcohol 92%. and so on in that left column. In the right column, of those who've ever used these drugs, it shows what percentage became dependent. And again, with tobacco, about a third of people who use it become dependent. With alcohol and cocaine, about a sixth. Heroin, about a quarter. And with anxiolytics and marijuana, less than 10%. So in terms of its risk of abuse, it's lower than a lot of the drugs that you have to schedule here. I also put in an article on the withdrawal syndromes. I have there are other articles on the withdrawal syndromes. Essentially, it's about 4 days of being more irritable. It's the same as tobacco in many regards. Being more irritable, maybe trouble with sleep. In the case of marijuana, they also lose some weight when they stop taking it. And whether it's an immediate precursor of a substance or other controlled substance schedule, I was a little puzzled by that because I think of a precursor as something that's chemically transformed into something else, and marijuana, of course, is a plant. So I looked up your definition, I included that. It wasn't very helpful. In your Schedule 1, I pointed out what you have there, which is anything that has to do with THC is bad. Schedule 2, I was somewhat puzzled. In that it says unless specifically accepted or listed in another schedule, it's, I have to get my other glasses on, but where are they? I don't get them all. But at some point in that, it does allow that the Board of Pharmacy can actually put things on Schedule 2 that are marijuana. Marijuana, when used for medicinal purposes pursuant to the rules of the board. Is that your board?
It is.
Anyway, I would just, in terms of whether you have to get an act of Congress or whatever to do this, the state legislature, I wasn't sure. And so I don't find any of the other drugs, and I will say in Schedule 1 there are things I've never heard of that I have no idea what are, but I don't think there are any derivatives other than those that you have listed in these other schedules. I'd be delighted to address any questions.
Thank you, Dr. McSherry. I do have a few questions. The Institute of Medicine study you referred to, is that the one dated 1999?
That is.
We've already received it.
Excellent, excellent. It's good reading. Petition sleep tonight.
In your opinion, do you think we have current scientific evidence that supports the medical use of marijuana?
Absolutely.
And in your opinion, do you feel the benefits outweigh the risks?
Yes. But that's based on the things that we've talked about here.
Correct. Okay, thank you very much.
Thank you very much for your time.